Hello, I'm Dr. Amelia Carter, a family physician with over 10 years of experience helping patients just like you, active, thoughtful people over 50 who want to make the wisest choices for their health and enjoy their lives fully. Today, I want to speak gently but honestly about something that quietly concerns many of us as we get older. The moment a doctor recommends surgery for knee pain, back issues, chest discomfort, or a spinal fracture, and we wonder if it's truly the best path, what recovery might really involve at our age, or whether gentler options could help just as much. These questions matter deeply. Major surgery after 50 can bring meaningful risks, such as longer healing times, potential complications like infections or blood clots, and effects on everyday independence that often feel heavier as the years go by. Research from the National Institutes of Health and large Medicare studies shows that complication rates tend to rise with age and procedure complexity, and evidence suggests that some common elective surgeries may not always offer the clear, lasting benefits we hope for, particularly when less invasive approaches are available. Recent analyses from the Lown Institute, reviewing Medicare data, have highlighted that tens of thousands of low-value procedures, particularly certain spinal and back surgeries, are performed on older adults each year, often without strong evidence of added benefit over simpler care. The Choosing Wisely initiative, supported by leading medical societies across the US, UK, Canada, and Australia, gently urges us to pause and discuss several routine procedures where, for many patients in our age group, the risks may outweigh the advantages. Wide variation in surgical rates for the same conditions, as seen in population studies, also reminds us that recommendations can differ significantly depending on the doctor or region. I've had the privilege of guiding countless patients through these very conversations, helping them explore options with kindness and clarity so they feel confident and supported, never rushed. That's why this video is called The Truth About Unnecessary Surgery Seniors Should Question, and it speaks directly to our thumbnail message of Police Car Light Unnecessary. Think twice. You deserve calm, evidence-based insight to protect your vitality. Stay with me, because what we'll explore next, drawn from trusted research and real experiences, can help you or someone you love approach these decisions with greater peace of mind and empowerment. Before we continue into the details of common procedures experts often encourage us to question, if protecting your health and making thoughtful choices as you age matters deeply to you, please like this video and subscribe to the channel. It helps more people just like us find calm, reliable guidance. And I genuinely appreciate hearing from you in the comments. Have you or a loved one ever faced a surgery recommendation that felt uncertain? Or what's your biggest concern about procedures later in life? Your stories build our caring community and help me address what matters most. Let's gently explore a concerning trend in healthcare for people over 50. The number of elective surgeries that research and expert guidelines suggest may not always provide the clear, added benefits we hope for, particularly when gentler options could be equally supportive. According to a recent analysis from the Lown Institute reviewing Medicare claims data, hospitals performed more than 200,000 low-value back procedures, such as certain spinal fusions, laminectomies, and vertebroplasties, on older adults over a 3-year period, often in cases without herniated discs, trauma, scoliosis, osteoporotic fractures with specific criteria, or other serious conditions that strongly warrant intervention. These procedures carried an estimated cost to Medicare of around $1.9 billion. The Choosing Wisely initiative, supported by leading medical societies including the American Academy of Orthopedic Surgeons, AAOS, gently encourages pausing to discuss common operations, like knee arthroscopy for degenerative meniscus tears and osteoarthritis, complex back fusions, and cement injections for certain spinal fractures, where, for many patients in our age group, The potential risks and recovery may outweigh the advantages. Large studies also reveal significant variation in surgical rates across hospitals and regions for identical conditions, sometimes differing substantially, which highlights that recommendations can vary and aren't always purely evidence driven. Why does this occur even among caring doctors? Systemic elements play a role, such as payment structures that can unintentionally favor procedures over conservative approaches, along with established practice habits or emphasis on quicker fixes for pain, even when time, physical therapy, or medication optimization often brings meaningful relief for many. I've listened to many patients who felt a gentle pressure toward surgery without a full discussion of alternatives. For example, one woman in her mid-60s described a rapid recommendation for knee arthroscopy due to ongoing discomfort, but after seeking another opinion and committing to structured physical therapy, she regained easier movement and daily comfort without an operation. A gentleman in his early 70s shared feeling urged toward a spinal procedure, only to find lasting ease through targeted exercises and supportive injections that kept his routine intact. But here's a common knee procedure that major guidelines, including those from the AAOS and Choosing Wisely, now urge us to carefully question before moving forward. The truly reassuring part is that this knowledge empowers us to engage in calmer, shared decision-making conversations with our doctors, leading to personalized choices that align with our priorities for comfort, independence, and hope. Many people over 50 manage these concerns beautifully with non-surgical paths, feeling stronger and more optimistic as a result, always as part of shared decisions with your doctor. One of the most common procedures recommended to people over 50 for knee pain is arthroscopic surgery for degenerative meniscus tears, often called a knee scope or partial meniscectomy. This involves going in with a small camera and tools to trim or clean out worn cartilage and tissue. It's frequently suggested when everyday activities like walking, climbing stairs, or getting up from a chair become uncomfortable, and many of us naturally assume it's the best way forward. Yet major medical organizations, including the American Academy of Orthopedic Surgeons, AAOS, the Choosing Wisely Initiative, and international expert panels, now strongly encourage careful discussion before proceeding with this surgery in cases of age-related degenerative tears, particularly when osteoarthritis is also present. A landmark 2013 randomized controlled trial published in the New England Journal of Medicine, along with a large Finnish sham surgery study and recent systematic reviews, including those in the British Journal of Sports Medicine, have consistently shown that arthroscopic partial meniscectomy provides no meaningful long-term advantage over structured physical therapy alone for pain relief, knee function, or quality of life in middle-aged and older adults. In fact, the sham surgery trial found nearly identical improvements in both the real surgery and placebo groups after 1 year, highlighting how much benefit often comes from rehabilitation, natural healing, and time rather than the procedure itself. Follow-up analyses have even raised gentle concerns that surgery might, in some cases, accelerate osteoarthritis progression slightly. Guidelines emphasize that, for many patients over 50, conservative care, such as guided physical therapy, gentle strengthening exercises, sensible weight management when helpful, and occasional anti-inflammatory support, often leads to similar or better outcomes without the risks of anesthesia, infection, or extended recovery. I remember a patient named Margaret, a lively 67-year-old from Ontario, who was advised that her knee pain from a degenerative tear needed scoping fairly soon to avoid further damage. Feeling a bit uncertain, she chose to try a dedicated 12-week physical therapy program first, after discussing it openly with her doctor. Months later, she told me how her knee felt stronger and more reliable than it had in years, and she was gratefully back to gardening and walking her dog with ease, no operating room required. Most seniors are never told just how often knee arthroscopy for these common age-related tears offers little added long-term advantage over non-surgical care. The hopeful message here is that many people regain comfortable mobility and daily confidence through conservative approaches alone, often feeling more empowered and optimistic in the long run. Individual results can vary, of course, and this is always as part of personalized care discussed openly with your doctor, but the evidence clearly supports exploring these gentler, equally effective paths first. Another procedure that's become more frequent for people over 50 with back and leg pain is complex spinal fusion, often added to decompression surgery for lumbar spinal stenosis, particularly in stable or low-grade degenerative spondylolisthesis cases without instability or deformity. This involves removing bone to ease nerve pressure and then using screws, rods, and bone graft to permanently join vertebrae for added stability. However, major medical organizations, including the Choosing Wisely initiative and high-quality randomized controlled trials, encourage careful discussion before routinely adding fusion to simple decompression in many typical age-related cases. Landmark studies, such as the Swedish spinal stenosis study published in the New England Journal of Medicine in 2016, and its long-term follow-up in the Bone and Joint Journal in 2024, found that decompression alone provided similar improvements in pain, walking ability, and quality of life compared to decompression plus fusion, without the additional surgical time, blood loss, or recovery challenges. Recent meta-analyses in the European Spine Journal, 2023 and 2024, reviewing dozens of trials, consistently show that, for many patients with stable low-grade spondylolisthesis and stenosis, fusion offers no clear extra benefit in function or symptom relief while increasing operative risks. Reviews note that complication rates from fusion, such as infection, implant concerns, or adjacent segment issues, can be higher in older adults, with some studies reporting up to 18% occurrence and elevated reoperation rates compared to decompression alone. A patient I remember well is Robert, a 71-year-old from Manchester who experienced leg pain and limited walking due to stenosis. His initial consultation leaned toward fusion, but after openly discussing the evidence with his doctor and exploring conservative options, he chose decompression alone. A year later, he shared how he was enjoying longer walks with his grandchildren again, feeling steady and grateful for a smoother path. Here's something most seniors are never told. Adding complex fusion often doesn't improve long-term outcomes over simpler decompression for typical stable age-related stenosis. Yet it significantly increases time under anesthesia and potential complications. The encouraging news is that many people over 50 find lasting relief and renewed mobility through decompression alone or non-surgical approaches like guided physical therapy, epidural injections for comfort, progressive walking programs, and posture support, often with gentler recovery and strong evidence of success. Individual results can vary, of course, and this is always best explored as part of personalized, shared decision-making with your doctor, but the research clearly supports considering these less invasive options first for greater peace of mind and hope. A procedure that often comes up for people over 50 experiencing chest discomfort is percutaneous coronary intervention, PCI, with stenting, placing a small mesh tube in a narrowed heart artery to keep it open, usually after an angiogram shows blockages. While PCI can be life-saving in emergencies like heart attacks, major cardiology organizations, including the American College of Cardiology, American Heart Association, and the International Choosing Wisely campaigns, strongly recommend careful discussion before using stents for stable angina symptoms, particularly when symptoms persist despite optimized therapy, as guidelines prioritize medical management first for many patients. The landmark COURAGE trial, published in the New England Journal of Medicine in 2007, with long-term follow-ups through 2015, showed that for patients with stable coronary disease, optimal medical therapy, medications, lifestyle changes, and cardiac rehabilitation provided similar protection against heart attacks, death, and long-term outcomes compared to adding PCI and stenting. The Orbita trial in The Lancet 2018 found no significant difference in exercise time or angina frequency between real stenting and a sham procedure when patients were on guideline-directed medications. More recent evidence, including the Orbita 2 trial 2023 and updated meta-analyses like the 2023 Cochrane review of over 5,000 patients, reinforces that in stable disease with well-managed symptoms, routine stenting does not reduce mortality or major cardiac events more than modern medical management alone for many patients, though it may offer additional symptom relief in select cases where symptoms are not adequately controlled by medications. A patient who comes to mind is David, a 69-year-old from Sydney, who had occasional chest tightness during exertion and was initially advised to proceed with stenting after his angiogram. After openly discussing the evidence with his cardiologist, he chose to optimize his medications, join a cardiac rehab program, and make gentle lifestyle adjustments. A year later, he told me his symptoms were well controlled. He felt more energetic for golf and family time, and he was thankful for avoiding an invasive procedure. This is where the real surprise lies. Most seniors with stable angina are never fully told that stenting often adds little long-term protection beyond excellent medical care and lifestyle support when therapy is optimized. The truly hopeful part is that many people over 50 manage stable heart symptoms beautifully with medications, cardiac rehabilitation, healthy eating, gentle activity, and stress management, often enjoying sustained relief and confidence without the risks of the procedure. Individual results can vary, of course, and this is always best explored as part of personalized, shared decision-making with your cardiologist, but the strong evidence supports prioritizing these proven, non-invasive approaches first for greater peace of mind and vitality. One final procedure that's frequently discussed for people over 50 experiencing sudden back pain after a minor fall or even no clear injury is vertebroplasty or kyphoplasty, injecting medical cement into a collapsed vertebral body to stabilize an osteoporotic compression fracture and reduce pain. These techniques became popular because they can offer quick relief for some patients, and in certain situations they may indeed help. However, major medical organizations, including the American Academy of Orthopedic Surgeons, the Choosing Wisely Initiative, and international guidelines, strongly recommend careful discussion before proceeding in typical osteoporotic cases. 2 landmark randomized, placebo-controlled trials published in the New England Journal of Medicine in 2009, along with their long-term follow-ups, a 2018 Australian trial in The Lancet, and the 2018 Cochrane systematic review supported by recent meta-analyses, have consistently found that vertebroplasty provided no meaningful additional pain relief or functional improvement compared to a sham procedure for many patients with acute or subacute fractures, though some evidence suggests possible benefits in very recent fractures, less than a few weeks old, with severe, uncontrolled pain. Conservative management, appropriate pain medication, short-term bracing if needed, gentle mobilization, and treatment of underlying osteoporosis often leads to similar pain reduction and recovery over weeks to months, with the vast majority of fractures healing naturally. The procedure does carry small but real risks, including cement leakage, adjacent fractures, or pulmonary complications, reported in up to 10 to 15% of cases in some registries. A patient whose story stays with me is Helen, a 74-year-old from Seattle, who suffered a painful compression fracture after a simple slip. Her initial specialist recommended vertebroplasty within days, but after discussing the evidence openly with her doctor and starting targeted pain control and gentle physical therapy, she found her pain eased steadily over several weeks. She later shared how relieved she felt to have avoided the procedure and still be enjoying her book club and light gardening comfortably. Here's the surprising part almost nobody knows. High-quality placebo-controlled trials show that vertebroplasty often provides no greater pain relief than a sham procedure for many typical osteoporotic fractures. The truly reassuring message is that the vast majority of osteoporotic compression fractures heal well with time and conservative care, pain gradually improves, mobility returns, and many people feel strong and hopeful again without needing cement injection. Individual results can vary, of course, and this is always best explored as part of personalized, shared decision-making with your doctor. But the strong evidence supports giving non-invasive management a fair chance first for greater peace of mind and safety. Now that we've looked at these 4 common procedures, knee arthroscopy for degenerative tears, complex spinal fusion for stenosis, stenting for stable angina, and vertebroplasty for typical compression fractures, let's talk about some gentle red flags and warning signs that can help you feel more confident and supported in any surgical discussion. These aren't meant to cause concern, but to empower you to pause and seek the clarity you deserve. One common red flag is a one-size-fits-all recommendation, when surgery is presented as the standard or only real solution without thoughtfully considering your unique age, overall health, personal goals, and values. Another is when non-surgical alternatives aren't fully explored. High-quality guidelines from organizations like Choosing Wisely and major medical societies emphasize that conservative options, such as physical therapy, medication optimization, lifestyle support, or watchful waiting, often work very well for many of the conditions we've covered. Pressure to decide quickly is also worth noticing gently. While some situations truly require prompt action, elective procedures for chronic or stable symptoms usually allow time for reflection, second opinions, or trying gentler approaches first. Research on shared decision-making, including large reviews in the Journal of the American Medical Association, shows that when patients have space to consider options thoughtfully, satisfaction, adherence, and outcomes often improve significantly. Here are 3 powerful questions I've found help my patients feel truly heard and informed. Feel free to write them down or bring them to your next appointment. First, what are the non-surgical alternatives for someone like me, and what success rates do studies show? Second, what are the potential risks and expected recovery times specific to my age and health conditions? Third, what happens if I choose not to have the surgery right now? What are the likely implications, and how would we monitor my progress? These simple questions open calm, respectful conversations and ensure your priorities are at the center. The beautiful truth is that taking a moment to notice these signs and ask these questions for many people leads to clearer, more personalized paths that align perfectly with your hopes for comfort, independence, and joy in the years ahead. You're advocating for yourself in the kindest, most effective way, always in partnership with your trusted doctor. As we wrap up our time together, let's focus on how you can truly empower your healthcare decisions and take proactive steps for your long-term well-being. First and foremost, seeking a second opinion or even a third is not only your right, it's often one of the wisest moves you can make. Studies, including large reviews from the Mayo Clinic and patient outcome research in the British Medical Journal, show that second opinions frequently lead to changed recommendations, with often 20 to 30% of cases resulting in a different treatment plan and many patients feeling more confident and satisfied. You can politely say to your doctor, I'd like to get another perspective to feel fully comfortable, and most caring physicians welcome this. The real power lies in shared decision making, working as partners with your doctor so your personal values, lifestyle goals, and comfort level guide the plan. Tools available in 2025, such as the Choosing Wisely patient resources, decision aids from the Agency for Healthcare Research and Quality, and trusted sites from the NHS or Health Direct Australia, offer clear, evidence-based summaries to help you prepare for these conversations. Beyond any single decision, the most effective path to senior health is proactive prevention, staying active in ways that feel good, eating nourishing foods, managing weight gently if needed, keeping blood pressure and bone health in check, and not smoking. These lifestyle steps, supported by decades of large population studies like the Framingham Heart Study and Nurses' Health Study, consistently show the strongest links to staying independent and vibrant longer than any procedure alone. Building a trusted healthcare team, doctors who listen, explain options calmly, and align with your priorities makes all the difference. And looking ahead, innovations like improved minimally invasive techniques, better biologics for joints, and advanced cardiac medications continue to make gentler care even more effective. You have everything you need to make informed, hopeful choices that protect your golden years, choices that let you keep doing what you love with greater ease and confidence. Thank you so much for spending this time with me today. Taking these moments to learn and reflect on your health is a quiet act of strength and self-care that you should feel truly proud of. I'm grateful for your trust, and I want you to know that by staying curious and advocating gently for yourself, you're already nurturing the vibrant, independent life you deserve. Keep listening to your body, stay connected with doctors you trust, and know that small, informed steps can lead to years of comfort and joy. I'm rooting for you every step of the way.